Hi everyone, I'm Dr. Rebekah Cooper and I'm a GP in Mpangeni. And in this video of our menopause series, we are going to be discussing vaginal atrophy, also known as vaginal dryness. And it's one of those things that we don't really like talking about. We maybe feel a bit embarrassed. It's quite a personal thing, but it is very important to know about and to discuss because over 70% of women will have symptoms of vaginal dryness or vaginal atrophy in their lifetime. First, we're going to look a little bit at some anatomical pictures that explain the relationship between the vagina and the bladder, and then we're going to have a look at what we can do about it. If we look at these anatomical pictures here, we can see the relation between the bladder and the vagina. So starting with this picture here on the right hand side, we see here this pubic symphysis, that's the pubic bone, then the bladder, and then the uterus, and behind the uterus, the rectum. This pipe here that goes from the bladder to the outside world is called the urethra. And looking onto the left-hand side picture, over here is the urethral opening. So here is where the urine comes out from the bladder, out into the outside world. This is the opening of the vagina. So we can see that the two are very closely linked with each other. So why is this close relationship between the bladder and the vagina important? Well, as Steph mentioned in her video, perimenopause is a time of large hormone shifts in our body, and one of those main hormones is estrogen. It is estrogen that helps us to have a thick and moist vaginal wall, like we see here on the left-hand side. As the estrogen levels drop, this thick wall becomes thin and dry, and this can lead to the symptoms that we experience as vaginal dryness. So we saw from those pictures that as our estrogen levels drop, the lining of the vagina becomes a lot thinner and we have dryness and irritation. One of the main symptoms that we get as a result of this dryness and thinning is painful sex. So whereas before you may have had a lot of pleasure from sex and you may have not had dryness, after menopause or during menopause, that perimenopause period, you might find that sex becomes quite painful for you or you need more lubrication. The other thing is because of the close relationship of the bladder, these symptoms can often manifest like a urinary tract infection. So sometimes women do get actual infection again and again and again, but sometimes they get the symptoms of infection, particularly that urge incontinence, I need to wee and I need to wee right now, or that stress incontinence, and they get that without actually having infection. So what do we do about this? One of the really great ways to treat it is with a local estrogen. So an estrogen cream that is applied around into the vagina and around the urethral opening. And we usually apply this 3 times a week on a Monday, Wednesday, and Friday night. And actually this estrogen cream is not absorbed systemically, so it only works locally, and a lot of women have had great success with this. Sex is less painful and they get less infections. The other great way to treat this is to go and see a pelvic health physio. They especially can help with the incontinence symptoms. So I just wanted to say again, I know talking about painful sex or things happening in the vagina can be very awkward, but it is important that you speak to your healthcare provider about them because there are treatments that we can do and things that we can do to improve your overall life and wellness. We hope you enjoy this menopause series, and please speak to your healthcare provider if you have any other questions.